These plans both have pros and cons. We'll go over the Medicare Supplement pros and cons first. Pros, it's broad coverage, okay? You have the freedom to choose and it's a nationwide network. Predictable cost, you pay your premium, most of your costs are gonna be covered. Stability, your plan can never be changed. It's locked in. It'll travel with you. If you move, you can take that plan with you. The cons of a supplement, higher premiums. Again, you're paying a premium in addition to that Medicare Part B premium. Rate increases. You need to always look at your plans and make sure that you're not in a plan that's going to increase significantly, because plans and rates do go up. You're gonna need to add standalone RX coverage to your supplemental plan. And there's no additional dental or vision coverage you would need to pay for those coverages. Now, the pros and cons of the Medicare Advantage. Pros, it's all-in-one coverage, okay? Cost savings, you're not paying an additional premium like you would with a Medicare Supplement plan. There's extra benefits. The dental, the vision, hearing, all of those benefits can be included with a Medicare Advantage plan. Care coordination. If you have a specific illness, emphysema, heart disease, there are plans that you can enroll in. They're called special needs plans. These plans are tailored to someone who might have that chronic illness. You'll have nurses to help you out, manage your health, your doctor visits, your medications. It's just an added benefit that you could enroll in. The cons of the Medicare Advantage plans, there's network restrictions. Networks are constantly changing, okay? From year to year, your doctor may be in network one year, not in network the next. Same thing with a hospital, okay? Potential for higher out-of-pocket costs. Now, where I really want to bring this up, that $7,550 maximum out-of-pocket is an annual calendar year out-of-pocket maximum. Let's say you are going to get treatment for an illness or a condition that's going to last 6 months, and that starts in November. From November and December, you would have that $7,550 exposure. In January, that would start over again. So in a very short period of time, you could reach that maximum out of pocket 2 times. Just be aware of where those cost exposures are, okay? Another con of the Advantage plans, limited plan options. The plan options are going to be limited to the county that you live in, are going to be different from counties across the country. Also, the plans aren't portable. So if you move out of a county to another county or a different state, you're going to have to change your plan. That plan might not be available where you're moving to. My final thoughts on good versus better. We have thousands of clients, and here's what they comment the most, okay? Medicare Supplement clients are extremely happy unless they get a rate increase, and then they're not happy. Medicare Advantage clients are happy until they have to navigate networks and get referrals. You know, the last thing you want to do is jump through hurdles when you need extensive medical treatments. It's the last thing that you want to deal with. Now, we've had clients that have been extremely happy with both plans, how they've covered very serious medical conditions. It just basically comes down to what works for everyone individually is different from client to client. That's why we're going to personalize these plans for you. When you set up your one-on-one consultation with us, we're going to break down what the plan options are. We're going to ask you what you think you want. We're going to review your doctors. We're going to review your prescriptions. We're going to go over all those very personal things so that we can help you make a decision with what plan you want, okay? Now, my final thoughts on good versus better. What are the biggest issues that I come across? What bothers me, okay? Your access to care. When you cannot see the provider that you want to or need to see when you need it the most, that bothers me. I'm going to do my best to make sure that that does not happen to you. My team will as well, okay? I've trained my team that we want access for our clients. We want to make sure that they are never going to be blocked from seeing a provider that they need to see. Skilled nursing is a huge hidden issue. There are some very nice skilled nursing facilities. There's also some skilled nursing facilities that are not very nice. No one ever looks at a provider directory and goes and looks at skilled nursing facilities. Most people don't even know what they are, okay? Look at these things. What we find the most is it's not you that's coming to us when you have an issue with a skilled nursing facility, it's your kids or your spouse. I don't want to send mom or dad there, or I can't send my husband to this facility. Usually at that point, it's too late for us to make a change, okay? Most people don't know what they have until it matters most. We are going to make sure that that does not happen. And I will advise everyone here, when you're looking at plans and determining situations like that, don't just look and make sure your primary care and your dermatologist are covered. Make sure that providers that you want to use in the future, if something serious are to happen, hospitals, facilities, treatment centers, skilled nursing facilities, make sure that they're in network, okay? Because we don't know what's going to happen next month, 6 months, a year down the road. And that's what the insurance for is, to protect against the unknowns.